You have health insurance. You pay for it every month. Somewhere between $600 and $900 leaves your household. Automatically, reliably. Before you've paid rent, before you've bought groceries, before you've done anything else with your money. It is probably the second or third largest recurring expense in your life, and you pay it because of a belief. The belief that when something goes wrong, when your kid breaks an arm, when you need an MRI, when the doctor orders blood work, the insurance will cover it. Here is what actually happens. Your kid falls off the trampoline. You rush to the emergency room. They take an X-ray. They put on a cast. They hand you a clipboard and say, "Your insurance is on file." You go home believing the bill is handled. 3 weeks later, an envelope arrives, $2,200. You owe it. All of it. Not a copay, not a percentage, the full bill. Because you haven't met your deductible yet. You open your insurance plan. You read the number. $3,000, maybe $4,000, maybe $5,000. That is the amount you are required to pay, out of your own pocket, in full, before your insurance covers almost anything beyond a basic checkup. And that number resets every single January. This is not a glitch in your plan. This is your plan. The most common type of health insurance in America, and the one most likely sitting on your benefits card right now, is called a High Deductible Health Plan, HDHP. And what it means in practice is this. You are paying $600 to $900 a month for insurance that does not pay for your health care until you have already spent thousands on it yourself. Let that settle. You are paying to be insured, and then paying again, out of pocket, for the actual care. The insurance doesn't start working until you've crossed a threshold that most American families never reach in a given year. The Kaiser Family Foundation, the most cited health policy research institution in the country, reports that the average family deductible on a high-deductible plan is approximately $4,600. That means a family must spend $4,600 of their own money on medical care before the insurance they are already paying premiums for begins to share the cost. $4,600. For a family that is also paying $700 a month in premiums. That is over $8,000 in a year before insurance functionally activates. For most families, especially healthy ones who visit the doctor a few times a year for routine issues, that threshold is never reached. They pay the premium every month and receive almost nothing in return except the safety net of catastrophic coverage. And that phrase, catastrophic coverage, is the one the industry avoids. Because that is exactly what a high-deductible plan is. It is catastrophe insurance sold under the name of health insurance. It covers the nightmare, the surgery, the hospitalization, the six-figure accident. It does not cover the reality. The ear infection, the sprained ankle, the prescription that costs $200, the lab work your doctor ordered on a Tuesday. That reality is on you. Every dollar of it. Until you hit the deductible. Now, you might be wondering, if this is such a bad deal, why is it the most common plan in America? Why would employers offer it? Why would anyone choose it? Because it comes with something. A three-letter acronym that was designed to make the deductible feel like a feature instead of a flaw. HSA. Health Savings Account. The pitch is simple and sounds brilliant. You contribute pre-tax money into a savings account. That money grows tax-free. You withdraw it tax-free for medical expenses. Triple tax advantage. No other account in the American tax code offers that. And for some people, high earners with low medical expenses who can afford to max out the contribution and let it grow for decades, the HSA is genuinely powerful. It is one of the best tax-advantaged vehicles available. But that is not most people. Most people who are enrolled in a high-deductible plan are not maxing out their HSA. They are not investing it. They are spending it on the very medical bills the deductible forces them to pay out of pocket. The HSA isn't growing. It's being drained. It's a savings account that refills slowly and empties every time someone in the family gets sick. The HSA was sold as the upside of the high deductible. For most families, it is a revolving fund for the costs the insurance refuses to cover. And here is where the vulnerability becomes personal. During open enrollment, that narrow window each year when you choose your health plan, most people spend less than 30 minutes making the decision. They see two options, the HDHP with a lower premium and an HSA, and the PPO with a higher premium and lower out-of-pocket costs. They do the simplest math. Which premium is lower? The HDHP wins on paper. The monthly cost is less, so they choose it. What they don't calculate, what the enrollment form doesn't calculate for them, is the total annual cost. Premium plus deductible plus copays plus prescriptions plus out-of-pocket maximum. When you add it all together, the HDHP is often more expensive for a family that actually uses healthcare. The lower premium is a lower entrance fee to a more expensive room, and you don't realize you're in the more expensive room until the bills arrive. You are making an $8,000 decision in under 30 minutes, based on a comparison that only shows you one variable, the monthly premium, and hides the rest behind terms most people don't fully understand. Think about what would happen if the enrollment form showed the total projected annual cost, not just the premium, but the premium plus the average out-of-pocket expense for a family in that plan. One number, simple, clear. Think about how many people would choose differently. Think about why that number isn't shown. Here is what you can do. And it takes 10 minutes, not 30 seconds during open enrollment while you're also eating lunch at your desk. Pull up both plan options your employer offers. Write down the annual premium for each, monthly cost times 12. Add the deductible. Add the typical copays for the number of doctor visits your family actually had last year. Add prescription costs. Add any specialist visits or procedures you can reasonably expect. Now compare the two totals, not the premiums, the totals. That is the number that tells you which plan actually costs less for your family. If you choose the HDHP, and it may still be the right choice, then the HSA is only valuable if you contribute more than you spend. If you are draining it every year on medical bills, it is not a wealth-building tool. It is a reimbursement cycle. Contribute the maximum if you can. Invest it if you can. But if you can't, know that the HSA is not compensating for the deductible. The deductible is still your cost. The HSA is just the account you pay it from. You pay for health insurance every month. It is one of the largest expenses in your household. And the plan most Americans are enrolled in right now was not designed to cover the healthcare they actually use. It was designed to cover the healthcare they hope they'll never need. The gap between those two things, between what you think you're covered for and what you're actually covered for, is the deductible. And the deductible is yours. Every dollar of it. Every year. Nobody explained that during open enrollment. 30 minutes, one checkbox, a decision worth thousands, made with almost no information at all. Now you have the information. Next open enrollment, use it.